Thank you. So welcome. We're really pleased you've joined us to see the launch of our brand new strategy, which marks 5 years of Equally Well UK. If you don't know me, most of you should do, but my name is Shazana and I'm the Equally Well UK lead. We have had a bit of a last minute change to the lineup today. Dr. Trudy Seneviratne is unable to join us as she's unwell, but we are delighted to be joined by the brilliant Dr. Ed Beveridge, who is Presidential Lead of Physical Health at the Royal College of Psychiatrists, to deliver a keynote speech and set the scene. So we do have quite an exciting and packed agenda today. We'll also be joined by Jan Hutchinson, Director of Programmes at Centre for Mental Health, who will present on our strategy and our 4 priority areas. This will be followed by a panel discussion with our Expert by Experience group, led by the lovely Dr. Dolly Sood, who's a member of the Equally Well UK clinical group. That will last for about half an hour or so, after which Jenny Banks, Associate Director of Business Development at the Centre for Mental Health, will be delivering a big ask of you all later. We hope to have some time for some questions or reflections, and Andy Bell, CEO of Centre for Mental Health, will close the session with his reflections as well. So without further ado, I'm going to hand it over to Ed, if you're happy to share your slides.
I will do that now.
Thank you.
So please feel free to virtually talk amongst yourselves while I share them. I think they should come through in just a second, and I will pop it onto slideshow. So I'm going to presume everyone can see, and I'm just shout if you can't. So good afternoon to you all. Absolutely honoured to be here and to be asked to do this today, particularly to be stepping into the probably rather nicer shoes of Trudy Seneviratne, who is recovering from illness. We all wish her very well, but I'm really, really delighted to be able to step in her place. She's the Registrar of the Royal College of Psychiatrists. My name's Ed, I'm a psychiatrist myself, and I work in North London, as you can see from my backdrop. But I'm here in a different role. I was very, very privileged to be able to take up a role which is called Presidential Lead for Physical Health. So our current president, who's Luddy Smith, identified a number of priority areas that she wanted to work on during her tenure. I've worked with Luddy on the physical health agenda for a number of years, and I'm really, really pleased that she has made it one of her priority areas and she's asked me to lead on it, because it's a real signal to you, to everyone, that this is a real priority for the college and that we really, really want to fix this problem moving forward. So really delighted to be here and to be able to take up this role and to introduce this fantastic and very important strategy launch. And what is the problem on which I am working? Well, this is a very well-known statistic, but it bears repeating again and again and again, which is that people living with a severe mental illness can die up to 20 years too young, 20 years younger than the rest of the population. And when I say this to people, when I actually quote this statistic, one of two things tends to happen. Either people look absolutely horrified, and that's kind of most people, I suspect a lot of people here, to think that people, as a result of having a mental health problem, might die that much younger than the rest of the population. But the other reaction that I sometimes see is kind of almost a bit of a cutting off or a glazing over, where people sort of look almost a bit stunned, or almost as though this has kind of become the norm, as though this is just what happens, or this is how it is. And I wonder a lot about that reaction that we see sometimes, and I do wonder if it's just feels too hard or too big of a problem for us to be able to engage with. But I'm very much of the view that we're all here to engage with it. We're all probably pretty horrified by it, and we all want to make it change. And the reason we want to make it change is because a lot of these deaths, I was about to say, are preventable. Death isn't preventable. We haven't quite cracked that yet. But a lot of these early deaths may be able to be prevented because they are generally the result of physical illnesses that we can prevent and treat. People die early from things like heart attacks, strokes, cancer, liver disease, lung disease. We know how to detect them, we know how to manage the risks, and we know how to treat them. Therefore, the early deaths are and should be preventable. And that's what we really, really want to work on as a group together. As I say, I've been working on this agenda for a number of years now, and my thinking has developed over time, partly as a result of some of the fantastic people that I've met who are experts in this area, some of the conversations that I've had. And I just wanted to sort of give you a bit of a sense of where I think we are, because there's the statistic about the premature mortality, but it's a lot more complex a problem than that. And I suppose the first thing to say is that unfortunately the problem seems to be getting worse rather than better. Because although everyone is tending to live longer, and actually there are parts of the country where even that trend is slowing down, the gap in life expectancy between people with severe mental illness and the general population is actually getting bigger. So what we might term the mortality gap is growing rather than shrinking, which is the wrong way round. We want it to shrink, not grow. Therefore, that means that we're driving an out of control tanker that needs slowing down before it needs turning round. So it's a really big scale problem that requires really big scale solutions. And it's a very complex problem. It's not due to any one specific thing. It's too big of a problem to attribute to, say, medication side effects or too much smoking or people being more commonly overweight. It's due to multiple, what we might call intersecting causes, because if you have a severe mental illness, you are also more likely to be poor, to have a history of trauma, to be from a marginalized group. All of those things make it more likely that you will develop all sorts of illnesses, not just mental ones, but long-term physical ones too. Therefore, we need to be thinking about this as a problem that will have a number of different solutions from all sorts of parts of the system, rather than sort of trying to focus on a silver bullet, as it were. Because of that, I think increasingly we know that this problem starts early on in people's life. So the roots of a long-term mental health problem are very similar to the roots of long-term physical problems. And as I've said, things like marginalization and deprivation are the roots of both kinds of illness. And the research tends to show us that people who are going to go on to develop a severe mental illness start to accrue physical health problems early, even before their diagnosis. So we need to think about this as something that we're focused on early in life and from the very start of people's contact with mental health services, rather than something we address via health checks later on in the process. And I guess all of that, which I've said, probably leads to my last point, which is that we have to look through this problem through the lens of equity and inequality, but equity in particular. And I guess an inequality might be something that you can explain. You know, one particular ethnic group might have a higher chance of getting type 2 diabetes than another. But inequity is that that group might get less good access to care. And we know that people, because they have a severe mental illness, experience less good access to prevention and healthcare. And that is unjustifiable, and that is inequity. So if we want to solve this problem and turn the tank around, we need to think of this through the lens of inequity. So why is this strategy so important? Why is it brilliant to see so much of us here, apart from to celebrate 5 years, of course, which is a brilliant achievement in and of itself? I suppose when I think of Equally Well, I think of the voice of lived experience and co-production being in the foreground. And the voice of lived experience is absolutely critical to providing better healthcare, because that is how we know what works and how we know how we get held to account. So I suppose any organisation that foregrounds the voice of lived experience is incredibly important in making sure that people like me who run services are providing the best possible service to the people who need to use it. The issue of empowerment, I think, is incredibly key. So having a voice of lived experience in the room at all levels is empowering, and it means that we can make sure that that voice is heard, because people with severe mental illness don't always have a voice, or have a voice that doesn't always get heard. If that voice is heard, people who provide services will change what they do, and people using the services will increasingly feel able to manage their own health and well-being with the support that they need to do so. I've mentioned equity as a key priority. I won't say more about that, but as I say, it has to be the thread that runs through everything we do in terms of our policy, in terms of our services, and in terms of what our wider communities are doing. Alongside that, I mentioned that this needs to be a cross-system mission, if you like. So it needs to involve, it can't just be primary care, or it can't just be mental health. It needs to involve all parts of the system, voluntary sector, informal organisations, faith communities, commissioners, you name it, they need to be at the table and part of the solution. Proper, really robust collaboration at all levels will yield better outcomes for us. Innovation is also key. I think as a representative from the Royal College of Psychiatrists, that's something I should be particularly interested in. We need to be driving high quality research, so we have drugs that don't make us put on weight, and tech that really helps us to engage in physical healthcare, and pathways that are novel. And I think that's something that I'm particularly keen to drive in my Royal College role. And finally, we must all show compassion. So we need to shift people from that glazed expression to the shocked expression when we talk about the mortality gap. We need people to really care about this as their primary motive for working on this agenda. So I think I'm going to leave it there and just say a thank you to all of you for having me. It's absolute pleasure to be here, and I'm really looking forward to the rest of the session. I'm really happy for people to get in touch if they've got ideas or thoughts about this. Always open invitation to hear from people, but I will stop sharing my screen now and hand back to Shazana. Thank you very much.
Thank you so much, Ed, and what a brilliant way to open up our session today. Thank you for stepping in so last minute as well. So really appreciate that. Going to hand over to Jan Hutchinson, who's going to present on our 4 priorities now. So Jan, over to you.
Hello, everyone. Thank you so much, Ed. We're really pleased to have such a great group of clinicians, including Ed and Dolly and others, and Wendy, who are on the call today, working on this alongside us at Centre for Mental Health and the Expert by Experience group. So I'm going to show you the wonderful new strategy on a page that we've developed and talk about the priorities for Equally Well. I work at the centre, and Shazana and I are working together on Equally Well, although she's doing the main bulk of it. We're looking forward to welcoming visitors from around the world at the end of this month when we have our Global Leadership Exchange, and great to see at least one person on the call from outside the UK. So following on, building on what Ed said, let me show you what things look like. So we have here the Equally Well strategy, our vision and purpose, and the values that Ed has worked through. So this has become really personally important to me, I think, in exactly the same way, just thinking about what is fair, what is equitable, how do we end up in a situation where people's physical illnesses are not given the early identification and treatment, and they're not given necessarily the importance and the care and compassion that they would be if those people didn't have a mental illness. So it's a fundamental societal inequity that we're really keen to work on together. And we know that many of you on this call are working on your own projects, your own services, and the ways of addressing this with people in your localities. So just to tell you a bit more about our priorities and how we'll actually do it. So this promoting equitable access, if you've been a friend of Equally Well over the last few years, you'll know that we've worked on the fundamentals of addressing poverty and the cost of living, and also that's been developed in a project that we did on addressing food insecurity. So we're going to continue with that line of work. It's very important for us to support people to have their annual physical health checks at the GP, and we've been encouraged by the outreach funding that NHS England have used to enable people to overcome any barriers to have those health checks, and for indeed those checks to be done outside of GP practices if that makes it easier. And there's been some examples of really good practice around the country that we have published a report about. So we'll be advocating for free access to flu and COVID vaccines again, and we'll also be making a case for priority access to NHS dentists, because again, oral health is so important, and that's something that people often find is way down the list of what they're able to access. So there's just a few ideas. Gyms and activities also really important, and how do we make sure that it's possible for people to use those in a way that feels comfortable and is appropriate. So moving on to unpacking co-production a bit. Co-production possibly means slightly different things to different people, but we've been delighted to have a really strong expert by experience group and partnership with Rethink from the beginning, who've been helping with that. And this co-production has been between the sort of organisational staff of Equally Well, which is Shazana and members of the working group, alongside those experts by experience and experts by profession. And together we've designed the delivery of our work, and we're going to continue to recruit new experts by experience and make sure that we can represent a diverse group of people, and to include the voice of carers. And we're looking forward to developing the skills of our expert group as well, so that they feel more confident and have greater skills in being able to speak up for the messages that we want to put across. Campaigning is what it's all about, and we have a great deal of energy for campaigning in Equally Well and its partners. We want to work with you all to carry on researching the causes and the remedies of this mortality gap. We want to lobby, well, maybe I shouldn't say lobby, but we want to influence government and feed into the consultation responses and opportunities we have for those types of joint work and meetings where we can make our strong together voice heard. I've mentioned the work we want to do with international partners, which will help both all sides of the world really think about what could move things on at pace, and how we can build on the knowledge and findings of one another's countries. And if there are things going on that we can amplify through our newsletter or through project work, if we can work together with you to bid for funding to do new pieces of work which will address the sources of inequality and reduce them, we'd love to do that. So we'll be supporting our members in your work. We have members of different sorts. We have NHS trusts, we have other provider organisations like councils and housing organisations. We have partners who are working in academia, and we're open to members joining us from any type of organisation. If you have a passion for this work and you believe that we can make more noise by joining together, you'd be very welcome to join. As I say, the areas that we'll be working on will continue to include healthy weight management, smoking cessation, diabetes, cancer screenings, and anything that you're doing that comes under this agenda, we'll be happy to talk about. So we're looking to continually expand our membership and work collaboratively with our experts by experience and our members. And this is an exciting time to be part of Equally Well. So if you're not involved already after this morning, I really hope that you will join us. And thank you, Shazana, for the opportunity to share.
Thank you so much for that, Jen, and thank you to everybody who has contributed and fed into the strategy as well, and for reading and reviewing it. Really appreciate that. So we're going to move on to the main part of our event today. We want to hear from the people that this is affecting. So Dolly Sood is going to lead a panel discussion with our Expert by Experience group. So we're joined by Marsha McAdam, who's the chair of the Expert by Experience group, by Hannah Moore, who's a vice chair of the Expert by Experience group. And we're also joined by Jason Grant and Nikita Lasovage, who are members of the group. So Dolly, can I leave that to you to lead the discussion?
Yes, thank you. And thank you for inviting me to chair. Just to provide a little bit of context, I'm a clinical pharmacist by background. I work in mental health, but I have completed a PhD where I had lots of conversations with different people, including individuals with lived experience and informal carers, about care for physical health in severe mental illness. So I have a little bit of insight here, but we're here today to hear about people's direct experiences. So Marsha, if I can start with you, please. In your time as chair of the Expert by Experiencing group, what do you think is Equally Well's greatest achievement in the 5 years that we've been running, please?
Thanks. So firstly, I'd also like to thank Kevin James, who was our previous Expert by Experience chair. And to celebrate as well all the other staff that had worked with Equally Well, whether it's through Rethink or the Centre for Mental Health. They are what's made us what we are. Their passion and determination in that as well. So Ed did on Ed's slides, he said about the mortality rate being 20 years early. I am one of those people. I am that person on that slide. I have both physical and mental health needs. I access social care. I use a mobility scooter to get out of the house. Every time I open my door, even before I go out, there's so much that I have to overcome, whether it's getting on a bus, having a taxi swerve past me just so that they don't have to take their ramp down, trying to get in to a hotel to register but can't because of how the door opens and closes and everything. Some of the people from the Centre for Mental Health have been part of that experience with me. And I feel that through being their ambassador and peer consultant, I've grown so much over the years that I'm able to articulate some of this stuff, because there's so many people that just don't have that voice at all. And my highlight of Equally Well is when Andy Bell years ago used to be invited to speak on a panel and it was all men. He was like, sorry, no. And it was really great to sort of see that, and a sort of I love working with, the team in that from the centre and Rethink. But for me, it was how we changed. We moved from the word obesity, which is around blame and everything, to the healthy weight management. It was when we felt really, really strongly about how going to a dentist is so traumatic because of past experience and that. And then we started talking about that, and we've not got as far as I wanted to, but we have got somewhere. We also then were talking about the food insecurity, and Hannah and Nikita and a few others have really put their heart and soul into that, because that affects us so much, and people forget about that all the time. It's cheaper to buy a sausage and chips at the takeaway than it is to build, to go and buy some fresh food in that. So to me, I feel Equally Well as a community that we continue to evolve together. My hope is that the long-term conditions strategy, the people involved in all of that, start collaborating with us, because as far as I'm concerned, mental illness is in quite a few of those areas. And so that in a nutshell is all the things that I've seen. and continue to love about Equally Well. And I'm sorry if I've gobbledygook because I'm a bit jet lagged, but yeah, that to me is everything. And just one final thing is we've really tried to get more experts by experience involved from various groups and ethnicities and that. And I guess my final thing is we need your help to try and make that happen, because there's so many voices that aren't round the table.
Thank you very much, Marsha. That wasn't gobbledygook at all. It was really clear, and you really brought those points across very well. Hannah, if I can come to you as Vice Chair and one of our longest running members of the Expert by Experience group, what are your own achievements during your time with Equally Well? And if you can, also name one project that you're really proud of, please.
So I'm going to be a bit cheeky. I'm going to mention a couple of things. So one being the podcast recently that I did, I think for it was done, I think in March, but it was it was about having severe mental illness and physical exercise. I did with Shazana and Simon Blake, who is the CEO for Mental Health First Aid England for Mental Health Awareness Week, which was in May. I was 28 stone at one point at my biggest. I'm now down to, I still need a lot of weight to lose. I'm now down to just over 17 stone. So I've lost nearly 11 stone, and it was getting active that helped me. So it was really fun to do as well. Simon and Shazana were so supportive, and they settled my nerves, which I'm now getting a bit nervous speaking, so I might babble a bit. But also Marsha and Ed mentioned the food insecurities project, and it was such an amazing project to be involved in. So I was and Nikita was involved, and I think other people as well. So we were trained as like peer researchers, and we interviewed people in regards to accessing to healthy foods and food poverty, because like Marsha said, it is cheaper to get like a McDonald's or a sausage and chips or whatever from the takeaway than it is to get some fresh veg, a piece of chicken, a breast or something, and some like new potatoes or something. Like, to eat a healthy meal, it's more expensive. So we were involved in this, a couple of us, and we were asked also to write a narrative each about the project, about our feelings and our findings. And this has actually been published in a few journals. I think that, I'm not sure what journals. I don't know if anyone can step in and say what journals or places. I think okay, well, maybe later put it in the chat or something. So I think that those are definitely an achievement since being part of Equally Well. But also personally, I think becoming vice chair has really helped me, as I've chaired meetings, I've attended the clinical group, the working group, and speaking at this event and speaking at other events for like different parts of my job. I feel like being vice chair for Equally Well has boosted my confidence and made me grow as a person. So I guess that's the bit about like the project and a bit about my personal achievement, I guess. So yeah, thank you.
Thank you very much, Hannah. Thank you. Nikita, if I can come to you now, please. You are another long-standing member of the Lived Experience group. What are the barriers to you for better physical health?
Oh, thank you, Dr. Dolly, and thank you for having me here today as well. I've been flighting between I'm going to come, I'm not going to come, I'm going to come, I'm not going to come, because I'm so nervous. So in the end, what I've done is I've written out what I was going to say. So I hope it's okay if I just read it to you rather than just speak so eloquently off the top of my head, as Marsha and Hannah have done. I'm very good at that. So okay, so what are the barriers to me for better physical health? I don't know if other people have heard me say this before, but I was once told by a psychiatrist that I had a choice to make. I could be mentally well but overweight, or mentally ill and slimmer. This, in a nutshell, is one of the major barriers to better physical health for me, because if the professionals involved in my care don't think that healthy weight management is possible or a priority, then what chance do I stand? Thankfully, I haven't encountered another professional attitude quite like this in some time, but I would say that it's definitely something to be watched and to bear in mind that the patient in front of you may be there for help with their mental health, but that's just one facet of their lives, and it can often be better to set healthy limits from the beginning rather than retrospectively. Even now, to an extent, after I've had a really hard year with my mental health, there always seems to be a barrier or something slightly more important, such as, oh, we'll address your physical health when your new medication is settled, or we'll check your weight when you've had your next blood test. And it does come across as something that just isn't as important to everyone as it is to me, which is disappointing. Another barrier for me to achieving better physical health is medication. And I do appreciate that not much can be done about that outside of the pharmaceutical world, but I think it's still valid because so many mental health medications still come with warnings of weight gain on them. And yet it does then become a choice of, well, do we treat your acute mental distress or worry about potential side effects? And it's obvious in the moment which choice is usually taken, and often rightly so. But perhaps there could be a way of mindfully prescribing so that physical health does hold that coveted parity of esteem with mental health. I've been fortunate enough while being part of Equally Well that these are the only barriers I could think of for myself personally, but I'm also aware of the difficulties such as barriers to physical health checks and food insecurity, just to name a few. To break down the barriers, we need to share experiences and opportunities, and I'm very grateful to be part of this one today. Thank you, and sorry it was read off of a piece of paper.
That was brilliant. Thank you, Nikita. And thank you. We do appreciate the effort and time. And I hope you don't feel so nervous now. That was really good. Thank you. And it's really highlighted again some of the key issues and themes that other people have spoken to. But it is really important that we all understand what those barriers are from your perspective. One of the things that I often hear is hard to reach or difficult to reach. And my response to this is, well, actually, patients and carers think we're hard to reach. We need to tip that upside down and say, actually, it's difficult for others to get access to us. I work in a hospital, I have done for most of my career, and I've also been a carer. And getting access to things can be really difficult, and it takes a lot of effort and a lot of time. And then when there are additional barriers, as you say, when people say those things to you, almost in a very thoughtless way, it doesn't really help your situation. So really, that was excellent what you've just said, and as I said, it's highlighted some really key points. And Jason, if I can come to you now, you have worked on a number of projects with Equally Well UK. In what ways do you think we can further improve our co-production practice, please?
Yeah, thank you, Dolly. Yeah, also thanks for the invitation. It's really great to be part of this launch, and wonderful to hear from colleagues as well. I guess for me, it's quite interesting, the co-production piece, because in my kind of experience, I feel that Equally Well does it quite okay, actually. So generally speaking, we kind of have quarterly meetings, there's an agenda being set, everybody has their own, able to share their own voice and opinions. We kind of come together and agree on the way forward, and projects are kind of distributed amongst the the experience group, so people can get involved in things that are particularly pertinent to their experience, I guess. The way it could be better, obviously all things could be kind of improved. I suppose first is the point what Marshall was talking about, getting different members around the table. So because I've been involved in Equally Well now for at least maybe 3-4 years or so, around the pandemic, I think I got involved. I need to kind of be edging myself out the door, really, right? And it's about trying to understand how can we, encourage and generate the next generation of EBEs to kind of keep this campaign running forward and making sure the lived experience voice is front and center. What would also help as well at times is maybe being involved in kind of like developing networks or developing opportunities, because a lot of us CBEs wear multiple hats. I wear a number of different hats, so we are part of networks. We are especially myself anyway, I pay attention to what's happening in the mental health space, so I'm always at events, I'm always kind of talking to people about things to do with mental health. So actually maybe the EBEs could have a greater role in kind of developing those networks and developing those opportunities for Equally Well. And I think lastly, it's just about the recognition piece. And I know this is a thing that EBEs always say in any kind of space. We do all this wonderful work. Do we get the kind of recognition and to really appreciate and fully understand what our kind of thoughts and contributions have made to to projects. And it's just making sure that feedback loop comes back to us, so that in 10 years time, when I'm still seeing Equally Well out there, I can say, I was part of that campaign, and we did make a real difference there.
Dolly?
Thank you. Thank you. Yes, Marsha, and see you've got your hand up, please.
So for me, last year was our 5th anniversary, and we were so excited about it, and we were going to have an event, but then in the end, hardly any people were coming, and people were having to pay for their own travel to get there, as clinicians and that, and to me, it broke all our hearts having to sort of say no. For me, what Equally Well is about everyone coming together and it being a relationship. And more than anything, I really want us to try and move mountains for next year to all come together, because we've got so much love and passion in that. But for me, it's about getting mental health trusts to fund youth to get to that place. And I think that's something that I personally am going to try and work on making happen, because when we do get together, it's really great because we all love and we're all caring about the same thing.
Yes, I agree. I think that personal contact, the human to human contact that you have, it adds something else. If you're in the same room with somebody and you're having those conversations, it's different to being online. Not that this isn't wonderful, but I understand exactly where you're coming from. And Jason, the point that you made about recognition is extremely important, not just from the point of view of you said, I'm doing research, and when people come to me and ask about experts by experience, and also in the academic field and universities, I always emphasize the need that actually, even in terms of being paid for the work that you're doing, it must be appropriately remunerated in a way that is appropriate for the work. So there are lots of people working in universities who have expert by experience, and we know that sometimes they don't get a formal contract, for example, or they're not paid appropriately. And these things are important. It's your time, it's your experience, and that can take effort, and there's a lot of things that go with that. So whenever anybody asks me about, I say, well, are you going to remunerate appropriately? Are you paying for travel, etc.? And if you're not, you definitely need to make sure you've got a budget for it, otherwise don't ask. I always come back with that, because I understand from that experience, especially when I did my own research, how important that is. And that is part of the recognition, as well as everything that you've said. So we've got, I think, about 5 minutes, haven't we, Shazana? If anybody else would like to add anything here.
Yeah, we do. No, we were supposed to be joined as well by Chris Lynch and one of our other expert by experience members, but unfortunately they weren't able to. So perhaps the questions that we had for them, I don't know if you want to just open it up to the rest of the panel, perhaps.
Yes.
We don't want to put anyone on the spot, but
yes.
If anyone can answer, it'd be great.
Yes. Okay. So yes. So if I just put this to all of you, and if anybody can answer, if you feel that you can. So when thinking about what our members can do to improve physical health inequalities, what top 3 things would you ask of our members?
Can I go first? So Jason touched slightly on it about the co-production bit. When I get involved in stuff, there's reasonable adjustments that need to be made, so that I'm able to be involved with both the physical and the mental health side of things. Sometimes that's not taken into account, whether it's funding or anything like that. But for us to do it meaningfully, that funding needs to be allocated at the beginning of the financial year, as opposed to trying to ruffle out. So that would be my one thing. Because, yeah, and then the other I touched on really is we really need to get into the long-term condition strategies, because that is in each. Mental illness is in most of those. And then we need to try and get more people involved. And I know we try tirelessly in that, but we are doing so much as a group in that. And so I guess for me it would be act as sounding boards for each other's and bounce ideas off each other, not just when a main meeting or that, if we have ideas in that. So continually collaborate in the conversation. I don't know if that would make sense.
It does make sense. Thank you very much, Marsha. Anybody else? No? Okay, I'm going to move on to the last and final question then. What are your thoughts on the poor health outcomes for people living with severe mental illness?
So I know Chris had this question, and unfortunately he's unable to join us today. And I think it was basically like Marsha said earlier, he's one of those people. We are one of those people who will die maybe possibly 20 years earlier than the general population. And I think that's really difficult for like people like experts by experience to actually realize that. And like I don't know how I haven't got diabetes, because my weight has gone up and down, up and down, up and down. But I just think that I'm not very good at a way of wording it, but the way Chris does it. But like, it's about being one of those people and the shock that it is to you, as in like, okay, I could be one of these people who die 15 to 20 years younger than the general population, and that is quite shocking, and that's quite upsetting, because obviously you have family, you have friends, and you think, am I going to be one of those people? Or because I'm on a lot of medication, and I know other people are as well, and other people have physical health conditions and mental health conditions and stuff. So yeah, I don't know if anyone else wants to come in. I didn't say that very well, but yeah.
I'm going to paraphrase what the World Health Organization says, that this is a scandal and a contravention of human rights. I think that summarises it quite aptly. Probably not exactly that, but it is something along those lines. And when I read that, it really hit home quite hard. Marsha, sorry, did you want to come in?
Yeah, so for me, it's usually when you go to a GP or that, or in the past used to be given straight away an antidepressant. And obviously then there's, you know, the weight that you would put on within 5 to 6 weeks you put on. Within 8 weeks you could pick up 5 to 6 kilograms. And then there's the hunger hormone called ghrelin, and where you never feel full, and that and you eat all the time, but no one tells you that type of stuff. And you know, when you put up slides at conferences and that, it does sometimes really hurt me to see that. Like Jason said, and Hannah and Nikita and all of us at Equally Well, we've got ABs, we've got so many different hats in that. And it's because we're experiencing that day in and day out, and we just don't want others to go through it. But it can be quite emotionally draining. For me personally, and that, but it does also give me purpose. And Chris is able to, just what he says in that. I say we just tear up the paper, and that I'm too stubborn, and I think doing what I do gives me purpose, but that is only through the support of Equally Well and the Centre for Mental Health, and that I have purpose, by feeling confident to use my voice. So that to me is everything.
Thank you very much. Thank you. And just to finish on that point, when I read a lot of the literature, that was one thing that was highlighted to me, is that even in the published research, there's very little discussion about, they talk about hunger, but it's almost like a fleeting mention. And there's no actual research about the extent of that, but people who are on these medications will often say it's like a bottomless pit. So I'm doing a project with University of Leicester at the moment, where one of the researchers there is going to be looking and exploring that a bit more. So hopefully there'll be something coming. And we are going to have to finish that, but thank you all very, very much for your contributions. Thank you. Shazana.
Yeah, thanks everyone. And you all answered really, really eloquently and very beautifully. And it just highlights why we're doing all this. So thank you for sharing your experiences and joining us today. Really, really appreciate that. So I'm going to now hand over to Jenny Banks, who's the Associate Director of Centre for Mental Health, who has got a big ask of you all. So Jenny.
Thanks, Shazana. Excuse me if I cough all the way through. I'm just recovering from a cold. But I think everything that I've heard so far today should really gee us up from what I'm about to give you all as well. I hope we're all in the right space, because I don't know about you, but it made me want to do more. So I'm sure it's made everybody else want to do more. So what a good place to start for my big ask. What is his? We'll find out. So, oh, go on. Why is my it's not going, can it? Ah, it is now. Never worked with children or big screens. So we are proud at Centre for Mental Health to be the hosts of Equally Well UK. I think that doesn't need saying, but I'm saying it loud and clear because we are. But I also want to say to you as the members that Equally Well UK, it's yours. It's membership owned and membership led and very much co-produced, as we've just heard, which is fantastic. And you as members, you're all here today because you're connected to the cause. You're connected to why Equally Well UK exists. And thankfully, quite a lot of you pay a membership fee, which is really helpful and keeps us going. And we really thank you for that. I'm really, really excited by the co-produced and exciting strategy that Jan introduced. It's our joint plan. So let's make it happen. It doesn't belong to us, it belongs to all of us. And we're really making an impact, and people, Marsha and others, and Hannah and Jason spoke about what's been good for them in their involvement of being part of the EBE at Equally Well UK. And it was really good to hear about them celebrating their success. And the Food Insecurity Project's been mentioned a couple of times, and there's a link to that at the end of my presentation, because I think that is a really good example of success. But as we know, and what we've just heard, there is so much more to do. People with severe mental illness need support to access good health promotion, and we've just heard that firsthand. So what is my big ask? 44k each year, which doesn't sound a big amount in the big scheme of things, is the income we need to stand still and just host Equally Well UK annually, as it is now, every year. Membership fees currently bring in a maximum of about 26k annually. I think there's some potential there that I'll come back to. So the negative equity could be 18k plus, and we can't keep that up. You know, we're all really, really compassionate and committed to Equally Well, but unfortunately it needs money to survive. So there's no funding at the moment to meet the ambitions that we've set out in that fantastic strategy. Yet the need is not in decline, as we've just heard. It's more important than ever. So what can we do? We've already spoken about some joint pieces of work that we've done. You as members, just think of Equally Well UK and how we can get involved in the things you're doing on the ground. Let's do joint funding applications and do some innovative projects that we can create together. Commission us. Yeah, we've done pieces of work with Kidney Research UK. We've done the mentally healthy systems piece in Greater Manchester. We've done an equality map in Greater Manchester, not linked to Equally Well, but the sort of things that the centre does could happen within the Equally Well remit as well. And I'll talk more about that later, and there's links to these reports to give you an idea of the sort of things that we could do together. There is work to be done. We know, we've just spoken about it. We're also very much up for sending a speaker to your local events. That brings a little bit of money in if you've got a budget for that. And as you've heard today, we've got some fantastic speakers available. Think of who your corporate partners are, and would they be interested in Equally Well UK and the reason why you're a member, and what more you would like to do, and how you want to make your membership work for you and for Equally Well UK. And then I was really thinking wild when I was doing this presentation and thinking, we all work in a workplace. Is workplace giving a thing? Is this possible? Could we have a tap to donate with an Equally Well emblem up and down the country in different places of work? That was my wild card, but I've thrown it in anyway. We could also do fundraising events and activity. I remember I was approached during lockdown, just before lockdown, by a mental health trust, and a group of staff wanted to do a sponsored bicycle ride and bring the money in for Equally Well. Unfortunately, COVID put paid to that, but it makes me think that we can do these things. We can help you set up GoFundMe pages, and we could put Equally Well's emblem all over it, and we can raise money for Equally Well UK together. And there's got to be lots of ideas that I've not even thought of when you think outside of the box on this. So it's really about the top of the page. What can we do together? Just to let you know that we do work for lots of people at the centre, and we've been doing quite a lot in Greater Manchester around their mental health systems. That really makes me think of Equally Well, because they wanted us to talk about the wider determinants of mental health, and physical health is one of those. And we've talked about equity. We know that there are wider determinants here. And we had a great testimonial from the Director of Public Health at Stockport Council, which you can read for yourself. But there's some great reports that you would want to read, I'm sure, and the links are at the bottom of my presentation, that might spark some ideas of things that we could do together in your patch as Equally Well UK with your organisation. So do take the time to look at the things we've done, using our experienced and fantastic research team in partnership with Equally Well UK. So my big ask is a personal pledge to you as members, as potential members, and lots more members to come. Bring your ideas to the membership events that we hold. We'd love to hear them. And contact us and share those opportunities that I might have sparked a little flare with. I'd really love to talk to you, and my details are at the end of the presentation. And spread the word, increase the membership and the visibility. 18 more members at £1,000 a year will bridge that gap in the funding. Share our reports and our news, and there's some examples at the end of my presentation. Tell people about Equally Well UK and why you're a member and what we've achieved. And we've heard an awful lot about what we've achieved today, but there's more to do, and we know that we want to do more. Tell the world about it. So in everything that you do in your everyday work, and we're all busy, but do please have Equally Well UK and my big ask at the forefront of your thoughts, and please do contact me if there is anything you'd like to talk to me about, how we could work together. So the links are in my presentation, which I think you'll send out afterwards, Shazana, to everybody. So the blog on the food insecurity piece is really, really worth looking at, and the piece Jan did around reaching out, the resources that we produce, there's an example there. We've done something on the economic and social costs of mental ill health, the work we did with Kidney Research UK. The Trafford report is an example of the stuff we've done in Greater Manchester, and it just might spark an idea of something that we could do in your locality. So I'd really love to hear from you.
Thank you, Jenny. That was brilliant. And yeah, please keep in mind, do get in touch with either myself or Jenny. I included my email in the chat, but I'll include it again at the end as well. So thank you. I think we're going to open up for some Q&As. We're going to Andy first. No, we're going to go open it for some Q&A. So if anybody has any reflections or any questions that they want to ask, they can either raise a virtual hand or include it in the chat. So Marsha, I've seen you've got your hand up, so I'll come to you first. Marsha?
Hi. I forgot to mention a shout out to Ian from Rethink, and I'm so sorry I put it in the chat. He really supports us EBs with his quiet determination, and I can't thank him enough for that. I want us to have an Equally Well roadshow, and before I went away to America, we'd already started thinking about me and Jenny and Shazana coming to Greater Manchester and going visiting the Mamas Poverty Partnership, which the Centre for Mental Health did some work around the Commission for Inequalities in Mental Health just before COVID. So we want to go back to see the mamas and everything like that. But it's my dream that we have a roadshow and that and get the mental health trusts in the area involved in that, to sort of share some of the stuff that we've been doing, but then also to get their thoughts on what they want us to do collaboratively.
Yeah, thanks, Marsha. Yeah, we look forward to doing more work up north as well. If anybody else has any questions or want to just, raise some reflections or anything. Otherwise, I will hand over to Andy then, and then we can get the power of time back. Andy, then are you happy to close and share your reflections?
Brilliant. Thank you, everybody, and
Thanks,
thank you,
Andy.
Susanna. It's been a real pleasure to have the opportunity to listen into this conversation today, and to have the chance just to kind of absorb the extraordinary contributions we've heard. It's sometimes easy when you're doing this work day after day to forget just how important it is and just how fundamental what we are dealing with is today. So I'm going to start with thank yous, because it's incredibly important that we do that. And I first of all want to thank all the experts by experience and all the experts by profession who have contributed today and over the last 5 years to Equally Well. Many are here today, some are not, but every single one has brought something unique and powerful to what we do and to the fund of knowledge that we've built up. And it's only because of those people and what you've given, and particularly those who are giving something of yourself and sharing information and ideas that are really difficult and really emotionally challenging to share. And the generosity with which you do that, I never cease to be amazed by. I do hugely want to thank the team at Rethink, Ian and colleagues, for your sterling support. It really has meant a huge amount to us to partner with you on this. Of course, I want to thank Shizana for your amazing work as our coordinator, and a word for Emma Bailey as well, who for many of the years of Equally Well was the person who got it all together. So thank you to both of you for work you have done. And crucially, thank you to members. Equally Well is about its membership. It's about people doing stuff. That's a very technical phrase, isn't it? So if you're doing stuff, you're part of it, you're an important part of it, what you're doing matters. So I've been listening and thinking, and here are just a few thoughts. Everyone here will have their thoughts and reflections. They're equally valid. I just get the chance to tell you mine, so lucky old me, eh? I think the first is a really fundamental one, which is that this is an injustice. The fact that people's life expectancy is shorter for no good reason is an injustice, and it hurts. And if it doesn't hurt, we're doing something wrong. So we need to remember that fundamentally, that this is about something which is deeply wrong in our society and which we have the power to change. I was really struck by what Ed described about the kind of apathy and the passive acceptance of the life expectancy gap that I see lots of places I go to. And the more you hear the numbers, the more you almost come to accept them. Well, we can't accept them. It's not okay. It's not right. And again, it's our collective job as a community of people to never accept that and to never take that kind of passivity as being normal. It's deeply not normal. I think we've heard so much during the course of the last hour, and indeed over the last 5 years, about how important it is to foreground lived experience. And that's about not just kind of doing things, having initiatives. You know, we often hear research talking about PPI, which I thought was a dodgy type of payment and protection, but apparently it's a way in which people put a formula to the involvement of experts by experience. This is about changing the terms of debate and shifting power imbalances. I love the way that Hannah and Nikita brought so much knowledge and experience to the work on food insecurity with Teesside University. We would love to work with other academic partners and do other pieces of research which brought that approach and the real power of peer research. This isn't just about a bit of co-optation. This is very, very different. But we know we've got more to do, and I'm really grateful to colleagues who do bring expertise by experience for the ways in which you help us be better at it, because we are still learning. We really are. We've got a lot more to learn. I think we've heard hugely about how it's important to start early particularly recognizing that so much of the inequality we talk about comes from people's younger years, and it's socially determined. The thing about something being socially determined is, of course, it can feel too big and too hard to deal with. Well, it's not. And again, it's about identifying the actions that will make a difference. And that comes to my next point, which is actually we do have the power to change this. Yes, it's big. Yes, it's getting worse. Yes, the pandemic has laid bare the appalling inequalities that people are facing. But actually, we can be the change, both together as a community and as individuals in the things that we do. And every project, every initiative, every action you take counts. I love the way in which the work looking at improving access to physical health checks. Yes, we know physical health checks by themselves are not a life-saving intervention, but they might be the start of a life-saving intervention. And the way lots of different local organisations, NHS, community, local government have come together to find ways of improving and equalising access to those is really powerful, and it shows you can make a difference. I think we've also realised how many barriers there are to equal health, how many hurdles people have to go through. Just listening to colleagues describing that is really powerful. So there is an enormous amount of work we still have to do. There's so much potential to build our collective impact. Actually, that was one of the basic theories of change behind Equally Well's collective impact. So let's make that collective impact the biggest it can be, and bring that love and passion that we've heard described for this. This is about more than just doing our day job. So finally, I think all I can really say is let's turn the tide on this injustice. Let's remember that equal health is a right, not a privilege. And let's never accept second best. And thank you to everyone for all you're doing to not accept second best.
Thank you, Andy. Really powerful and really nice to hear your reflections as well. So thank you. Thank you to everyone for joining us today. Thank you to all our speakers. Really great to hear from everybody. Ed, Jan, Dolly, Marsha, Hannah, Jason, Nikita, Jenny, and Andy, of course. Really appreciate all your input and everybody who's fed into the strategy as well. It's, you know, it was a hard slog, but we got there in the end, and we look forward to delivering that over the next 3 years. So thank you. Please do get in touch. Please do keep in mind our asks, and please do get in touch with either myself or Jenny if there's any opportunities you want to explore, and enjoy the rest of your day. Thank you, everyone.
Shazana, can we stay on?
Yes, of course we can. Yeah.
Thanks, everybody.
Anybody who wants to stay on from the team, very welcome to.
I'll